A hairy tongue is an unnatural and transitory covering on the tongue's upper surface. Though the name and look may give the impression that hair is growing on your tongue, this disorder has nothing to do with hair development. Today we discuss and understand the causes, symptoms, and necessary action to be taken to avoid the same. Please like, share and subscribe our channel to motivate and work on topics unique and create health awareness. Thanks. Cheers. Hairy tongue, also known as lingua villosa or black hairy tongue, is a very rare and harmless ailment characterized by keratin growth on the tongue's surface. Despite its name, the tongue does not have hair. Instead, the papillae, small, finger-like projections on the surface of the tongue, grow extended and may seem hairy or fuzzy and hazy. Hairy tongue is often caused by an accumulation of dead skin cells, germs, and debris on the surface of the tongue. These chemicals are normally lost spontaneously, but in the case of a hairy tongue, they build up and give the tongue an odd look. Poor oral hygiene, some drugs, such as antibiotics or those containing bismuth, cigarette use, excessive alcohol consumption, mouth breathing, dehydration, and certain medical conditions can all contribute to the formation of a hairy tongue. A hairy tongue can have a variety of appearances. Depending on the etiology and the chemicals that accumulate on the papillae, the tongue might appear black, brown, yellow, green, or white. The disorder is sometimes linked with poor breath or a metallic taste in the mouth.
Hairy tongue is often a harmless ailment that heals on its own without treatment. However, following excellent oral hygiene practices, such as brushing the tongue or using a tongue scraper to remove buildup, can help avoid or lessen the development of this condition. If the hairy tongue persists or causes substantial discomfort or worry, it is best to see a healthcare expert or a dentist for a proper diagnosis and treatment. Risk factors. Certain things might enhance your chances of acquiring hairy tongue. Poor oral hygiene, tobacco use, smoking or chewing tobacco, excessive alcohol intake, some drugs, such as antibiotics or those containing arsenic, head and neck radiation therapy, and certain medical diseases such as AIDS or a condition known as dry mouth are examples. Hairy tongue types. Hairy tongues are classified into 3 types: black, brown, and white. The most frequent and obvious kind is black hairy tongue, which is distinguished by a black or dark brown coloring of the tongue. Brown hairy tongue is distinguished by a brownish coating on the tongue, whereas white hairy tongue is distinguished by a white or yellowish-white covering.
3. Causes. Although the specific cause of hairy tongue is unknown, various factors contribute to its development. One key effect is the disturbance of the tongue's regular shedding of dead skin cells. Poor oral hygiene, a lack of stimulation to the tongue, which can occur when certain medical conditions or drugs restrict saliva flow, and an overgrowth of germs or yeast in the mouth can all contribute to this. For symptoms, in addition to the hairy or fuzzy look of the tongue, patients with hairy tongue may have other symptoms such as a metallic taste in the mouth, poor breath, halitosis, an altered taste sense, choking, or a tickling or burning feeling on the tongue. Five, treatment and prevention. In most situations, hairy tongue goes away on its own. However, excellent dental hygiene is essential for preventing or reducing the appearance of hairy tongue. Brushing your teeth and tongue twice a day, using a tongue scraper or soft toothbrush to gently clean the surface of your tongue, and having regular dental checkups and cleanings are all part of it. If the hairy tongue continues or causes substantial discomfort, a healthcare expert or dentist may suggest further treatment options such as medicated mouthwashes or drugs to prevent bacterial or fungal overgrowth. It's worth mentioning that, while a hairy tongue might be unsightly, it's usually a harmless condition. If you have any concerns, or if the disease persists or worsens, visit a healthcare expert or a dentist for an accurate diagnosis and proper treatment. Please smash the like button now and support us by clicking the subscribe button with the bell notification. Please do share and comment your views to understand you better. Thank you. Cheers.